So one of the things that we need to remember as a dental assistant, that actually the majority of the time that the patient spends in the chair is with you. So we are the ones that is greeting the patient in the waiting room, seating them in the room, verifying, that you have the correct patient, and verifying to make sure that the patient and you are on the same page with what procedure is being done, whether it's a new patient exam, an extraction, and maybe impressions for a night guard, some bleaching. So what we need to do is we want to be a great asset to our office. We don't want to be just, in a sense, another dental assistant. You want to be confident, you want to increase your skills. We don't all have to continue on with our education program and be a part of those continuing education courses, but those courses are a great way to continue your knowledge, to be more aware and more confident in your communication with your patients. There's a lot of times that when your doctor comes in, or you see that patient might be on your schedule and is concerned about maybe they have bleeding gums, or maybe they're interested in getting an implant because they had a tooth extracted a few months ago or a year or two ago. So if you know why that patient's coming in, and if you have communicated with that doctor that you're both on the same page, patient education is extremely important for treatment plan acceptance. So it is your doctor's job that he or she knows that, by legal terms, that he or she is the one that is documenting or is saying what the treatment plan is. They are reading the x-rays, the doctor is the one that's looking at the mouth, and they're saying the patient needs A, B, C, and D according to their treatment plan. So you're documenting that as a dental assistant to keep track of what that patient needs, and documenting it, and documenting that on your computer or paper charting if that's what you may have. So as you can see, we have a couple of things out here for patient education purposes. Models are a great example. Models are something that gives everybody a visual. So not all of us are getting that concept of what those patient education are when it comes to the treatment plan just by speaking about it. Some of us really need to see it in person. So these are just some great examples you can get from your dental reps, you can get from the American Dental Association. John has a pamphlet in his hand that is just like a flip book. So this is an example of a mini implant case that maybe this patient was here for a denture consult. This is just a lower mandibular denture. It's common that lower mandibular dentures don't fit that well, and maybe this patient has decided to take those steps financially to invest in some implants, so this is an example of what an implant procedure would look like. So when the denture snaps onto that implant, then that patient knows what that expectation is. Okay, so the flip book here is going to go through the same thing.
Yeah, so as dental assistants, it's important to remember we are by no means recommending treatment to patients, but when patients come in and they immediately start saying, I'm thinking about getting an implant, what's a cap, what's a crown, these are simple questions that we can ask, and we're not by any means are we recommending the treatment. We're simply educating our patients, and a lot of times by illustrating, whether it's through flip books or models that the patients can see for themselves. Now they get a better understanding of what exactly it is that the doctor is going to recommend. It makes the case acceptance a lot higher overall for the office, because now it's been explained by the dental assistant. The doctor can come in and say, oh yes, I do agree with that.